Happy Friday, everybody. It is Amber Kivett here with Life Pro. Super excited to see all you guys here today. Please don't hesitate to share with me where you're located. It is Good Friday. It is a beautiful day here on the far west side of Indianapolis, Indiana, here in the Midwest, where the weather is highs and lows. Today it's going to be in the high 70s and sunny, and it's spring. So it's like we're growing and we're glowing and we're just getting to being our best self. But what an awesome day to share with all of you today. So thank you for being here. Today is about sharing with you the different technologies or the different biohacks that you can use from the convenience of your home, or maybe you can work with a therapist locally in your area into what we call biohacking, and that we can not only accelerate but optimally recover from any kind of surgery that you've overcome, whether it was a trauma-based surgery, whether it was an elected surgery. But there are a lot of different things that you can do on your own without the intervention of a physician or a therapist or a medical professional, in which you can kind of expedite or provide the optimal environment for your body to be able to heal itself as it has been created to do. What we are going to show you today is how you can use a variety of different technologies, specifically phototherapy, which is red light therapy and infrared light therapy, PMF, which is pulsed electromagnetic field radiation. Then we've got our whole body vibration. You can also use a massage gun if you'd like to. We now have the massage gun extender handle so that you can reach into those tough spots on the backside. But I want to just go through and show with you, show some of the different products that Life Pro uses or offers you, so that if you have overcome a surgery, or if you're getting ready to go into a surgery, and you know going into it that whether it's a total knee replacement, a total hip replacement, spine surgery, if you're having some enhancements done, if you are having a mastectomy, there's a lot of different things that we can elect to do, and a lot of things that we don't choose for. And going into surgery is adversity, or like an obstacle or challenge that you have to overcome. So if there's a way that we can give you relief at home, or if we can help with the healing process on the other side, even if it's mentally, that's what we're here for. I speak from experience in that I have had now 4 abdominal surgeries. Many of them I chose not to do. It was just some motherhood, womanhood challenges, and wanting to have a child, losing a child, infertility, having a hysterectomy. I've got 4 abdominal scars. I've had 2 different breast surgeries, had one years ago, had a reduction. So anytime you have a scar along the front of your body, it changes the entire makeup of your entire body. So when it comes to surgeries, our entire body changes forever. And so if we can do different things in order to enhance how our body is able to move forward, adapt, and adjust without having any setbacks, that's what we're here for. So I'm speaking to you on behalf of experience. I went through 2 surgeries with the same surgeon January the 17th of this year. They were elected surgeries that I'd had done. I had some surgery up top, and I had some surgery down low. And so I've been not able to do as much for 2 months. I'm just not getting back to my workouts. But I'm so grateful that I was able to have Life Pro products on hand in order to help me in feeling like I was contributing to my recovery outside of the gym. Because for somebody who loves to be in the gym, at least 3-4 days a week doing exercise programs or doing resistance training, when you're told that you can't really do anything for 4 to 6 weeks, it's like that's not fun. So what can you do? Well, there's actually quite a few things that you can do that you can feel like you're getting something out of your time in recovery and your break in your schedule. And if you can plan ahead of time and coordinate, if you are working with a physical therapist, if you can coordinate ahead of time with what their plans are, so that you're not doing too much all at once. But all of these different therapies, or modalities as we call them, these biohacks, are going to be things that you can do in addition to your physical therapy regimen, so that you're not complicating things, but you're actually making their job easier, and you're making your life more tolerable. So all of these are intended to help you, not to hurt you. And I'm going to be honest with you, when it comes to physicians, a lot of physicians have no idea how some of this technology works, and they don't have time to deal with the research studies, the clinical evidence that validates it or questions it. But I will just tell you, my job full time in my facility, as you see it, is providing instant pain relief. And my expertise is working with not only scars, but also working with spine. I work with a lot of spine, work with a lot of total knees, total hips on the other side of the progress recovery. So after they've already been through the therapy process, I'm the one that goes in and starts to kind of remold, reshape, create more pliability, and teaching them how to take care of themselves at home through the biohacking process. LifePro is one of the world's top biohacking companies, and so many different technologies that you can have from the convenience of your home. What would be considered residential use? So it's not medically used in most facilities because it's that's at a higher frequency, higher hertz, higher intensity of bulbs necessarily. But I will tell you, if you go to your local med spa, if you go to your local esthetician, you're going to your local tanning salon, you're going to get the same stuff here through LifePro as what you're getting in those facilities, and you're paying the same money that you can pay every month is what you're paying for having these at home and on your own time. So let's jump into some of this. I see some of you are joining in, so if you have questions, I can see your comments. Please don't hesitate to ask questions, because I'm one of the top experts in the nation as to how you can provide the optimal environment for the body to heal itself, but also I specialize in instant pain relief without using medication. So I don't use medication, prescribed medication, don't even dabble in it. It is all understanding how our body goes through restoration, recovery, regeneration after trauma, but also how our mind has some kind of intervention, or how our mind can dictate how our body actually heals. So do make sure that you're keeping your mind right, you're staying positive, and you're not thinking to yourself, why is this happening to me? And rather seeing, why is this happening for me? What am I supposed to learn from this? Because if you see yourself as a victim, as to what's happening to you, or you are going into this with fear, or you're coming out on the other side with fear, you are going to heal at a much slower rate, and your cells in your body are not going to heal at an optimal level so that you can age younger as years roll forward. Your mind actually has the power to change hormonal release in the system and changing the electrical highways in the nervous system. So make sure that you are staying as positive as you can, that you're surrounding yourself with the right influences. We at LifePro try and push that energy hard to everybody. But if you need help with some of that, you can feel free to look at my page directly. It's Amber Kivett, as you see on the screen. Kivett Kinetic Solutions. I'm known for the magic. We've got Debbie, who is in Canada, and we've got Roseanne, who is out on the West Coast. We all pump hardcore, positive energy, because we have to lead in taking care of the world. And that's a pretty big job, being a superhero in certain ways to so many people, not even knowing how you're receiving our energy. So it is our intention and our top priority to make sure that we are leading with purpose, leading with positive energy, and giving you the best information possible based on the most cutting edge research and clinical studies, so that you are not gambling with your life. So I see that Brenda is joining us. She's in a walking boot from ankle surgery with plates and screws, starting PT soon, interested in options. I got something to show you, Brenda. Let me show you something really quick. You keep watching. I'm excited to share this with you. I had a gentleman in just the other day, a professional athlete. He had exactly what you're talking about, plates and screws. So I want to show you a picture of what that injury initiated, how it originally looked, and this will blow your mind. So his scar now looks like that. Okay, so you can see the scar there. Okay, that was after I worked on him the first time using some of this technology. The vibration platform is probably the most powerful tool that I use on a day-to-day basis. That is the inside of his ankle. Okay, so I'm giving you my firsthand experience as a clinician, as a licensed certified medical professional, as to how these products are using that we're using in my facility in order to help other people all the way around. This individual was not able to walk in my facility the first day he came in. And I'm going to show you right here that we've got, let me make sure here that I don't disconnect from you guys with my Bluetooth. So let me kick that off so I don't do that by accident. That would be bad if you can't hear me. That would be no fun. This is him the first time that he met me on our vibration platform. And I'm getting ready to show you here how to use that, so that you can have, guidelines as to how you are going to be using it, from the convenience of your home, knowing that it's safe. I use this on every surgical, post-op injury recovery. We started in a standing position and then we ended in a seated position. Okay. Yes. You have the exact same scenario, Brenda. And I actually have a picture of what his foot ankle look like. Let me see if I can find him on here, because I was not planning on popping this up, but I have permission to share because he's a great person, and I'm kind of a superhero to him right now, after getting him where he needed to be, because he's 4 months post-op and should have already been doing a lot of things that he was not able to do. But this was his. Here we go. There we go. There's his surgery right there. So we've got plate and 11 screws. So Brenda, exactly your case and scenario. This was post-op, what his looks like before I saw him. So that was 4 months ago. My point here, my friends, it is never too late to start attacking a scar. And I like to attack them head on. So there's initially, okay, I met with him for the very first time last week. He limped into my facility because he was not able to do what he wanted to do. You can see from the looks of this how thick his Achilles tendon is from not being able to do as much, and a lot of swelling, and his calf is shut down by at least 50%. It only takes 14 days for your body to lose 50% of its strength gains because of inactivity. And if your doctor's telling you you can't do anything for a period of 4 weeks, I'm going to tell you right now, if you are able to use a bike in physical therapy, if they put you on a seated back, a recumbent bike, or an upright bike, if you're pedaling a bike, you can get on the vibration board from a seated position. Even if you're still in a walking boot, if you are in a removable splint and they don't want you weight bearing yet, they want you to stay on crutches, you can still use the vibration platform in the boot. Use the boot, put the boot on, and actually sit on the vibration, because the vibration will travel through the boot, and vibration stimulates the body to regenerate itself. It is an enhancer in how our body regenerates. And because of impact, it's not the vibration that causes problem. It is the impact making contact with the ground and how your foot actually lands in contact with the ground and those biomechanics. So if you're in a boot and you are limited, this goes for anybody who has had a recent surgery, this goes for anybody with an ankle sprain, you can get on the vibration platform in a seated position with your boot on, okay? If the doctor is telling you, or the physical therapist is telling you, that you can use a bike, excuse me, if you can use a bike, then you can use the vibration platform outside the boot. If you are able to walk in the boot, as long as the boot is on, you're able to load full weight bearing with the boot on, not taking the boot off, but putting the boot on, then you can actually take the boot off and just stand on the platform, not walking with it off, but standing with the boot off, because you're not impacting and you're not changing those biomechanics. But the vibration is generating a gentle earthquake, working up inside, breaking down scar tissue little by little. But the most important part of what vibration does is it is a stimulant to 90% of our muscles to shorten and lengthen and excite anywhere from 10 to 50 times per second without your brain providing the signal for it to happen. So it is an action, or it's a reaction to an action. And because your brain has been disconnected from your foot and you got to get things jump started, that's the biggest danger in walking around with a boot on or without a boot on, because your neurosensory is disconnected. It's shut off. You got to get that back. That's why you go to physical therapy. Your neurological system is not communicating the same way. The electrical highway has been shut off. We got to turn it back on. The vibration platform does that, but so does a massage gun. So I have him using the vibration platform. P2 setting is what I have for him, because I want to pack a punch. And we're doing it in a seated position. So we're not straining the body. We're not changing the biomechanics. We are just exciting muscles to start firing so that we can build that calf up when he actually is able to load. Turns out, because he's 4 months post-op, he should have been loading 2 months ago, and he still couldn't walk normal. So today he is walking, he is jumping, he is skipping, and he's got a chance to play at a higher level of professional football, which is really cool because we did it in less than 2 weeks. And it's taken a physical therapist 4 months to do nothing to get him to this point. Not knocking a PT because they're not all the same, but a lot of time wasted. And if he would have known that he could do some of this at home, then it would have helped him. So let me grab some water. Excuse me. So this was the this was the first time I worked on his scar. Okay, so you can see this is untouched, and that's untouched. They had not done any soft tissue work, no scar work on the scar, just exercises, which really weren't benefiting him much. So Amber comes to work and starts using some of our Life Pro products. That is the front of his foot ankle before. As you can see, he cannot get full motion in dorsiflexion or plantar flexion, which is why he was limping, just walking in his everyday shoes. So as we use vibration, you got to see the video after the fact, or me putting him through that motion. You can also see in this video how I'm working the inflammation and the swelling and the fluid out, and that should have happened a long time ago. But it actually is changing as I'm using my hand to push all that out of there. But we use the vibration platform to break it free first before I started to mobilize it. Okay. So what's really cool is I have my own cupping brand. Life Pro has its own cups as well. And so cupping is really powerful when it comes to breaking stuff free. Life Pro does carry their own brand of cupping products. So we can kind of dabble in that at a different time because I just made for today about red light and vibration phototherapy. But the good news is I'll show you the video of him after the fact. Okay, so that's after we've done vibration. That is after we've done some scar work, after we've started exciting those muscles, and I've taught him the right exercises to be doing. That is the after product. Okay, and then here's what's really cool. He was incredibly emotional as to being able to walk again. He can walk completely normal. And that was in less than 2 hours using Life Pro products. So it's pretty powerful how it works if you have the direction on how to do it. So that's what I am here to share with you is it doesn't have to be a foot ankle. It can be really about anything. I got some other pictures here of success before and after. So if you bear with me here, if you do have questions, please post below as I'm keeping an eye on some of these. We've got, hang on here. This is a video of me using not only vibration, but cupping at the exact same time. Another post-op injury recovery. Okay, so he's just standing on there, but you can see how he's able to start shifting. He could not walk normal. He could not do a squat. We're using vibration and the cupping process in order to release scar tissue, activate muscle firing, and putting him in control so that he can actually re-educate his muscles on how to work. So if you have the Life Pro cupping products, instead of putting a bunch of them on there using the Amber brand cups, you can use the Life Pro products, and you can use their automatic power operated cupping system. Works great. But those are just some different, let's see here. I've got some other scars before and after. This is another gentleman. I went to his home and did his post-operative care after total knee replacement. The picture right here is 2 weeks post-op. This picture right here is 48 hours after I worked on him. I had him rinsing one of the Life Pro vibration platforms at home. He was seated in a position in which he was able to move his leg based on what the doctor's restrictions were for 2 weeks post-op. You got to start moving that knee. So we had the beautiful thing about the vibration platform that your hands or that a massage gun doesn't do is it breaks down scar tissue you don't even know is there. And the worst thing that can happen in a total knee replacement or a total hip replacement is you don't get the motion, the appropriate range of motion before the scar tissue sets inside the joint where the prosthetic is. If that happens, then if we can't break it down from the outside, the surgeon has to go back in within a month and break it in and start all over, not scoop out the joint and clean it out, but actually break the scar tissue manually. It's like a 30-minute surgery. and then you're off and running to rehab again. But you have to go through the anesthesia, and you got to put your body through that stress and that trauma twice because you don't have access to the secrets. So here's the secrets. That was, again, 2 weeks post-op, 1 month post-op. So Scar is looking beautiful. And again, all has to do with the Life Pro products and how we are able to use them to our advantage. I could go on and on and on about some of these different things. Let me see here. I've got some pictures here with using red light therapy on some traumatic recoveries. And there we go. Yeah, so this young man, don't gross out on me, okay? That's before surgery. That is a dislocated foot ankle that's in the doctor's office after the injury before the surgery. Yep, pretty ugly, right? You can see how it is not good, but that's the picture going before the surgery took place, okay? Now here's what's cool. I'm using red light therapy on him after his surgery, okay? So he came over to see me. He's already had the fixation, and we're just using the Lumicure light therapy torch. $50 is what that tool costs now, if you can still get it on Amazon or our Life Pro page. And I'm just making direct contact with his scar line. So Brenda, this would work for you as well. He was in a walking boot post-surgery, and he was walking normal, skipping, jumping in 4 weeks. 4 weeks. It was very fast. Football player, high school football player. So we didn't have any of the fancy Life Pro products out at the time. We just had the basic entry level. We were just getting started in it. This was 5 years ago. And so I'm working him from both sides. Okay, just put in direct contact with. Now we have full size blankets. We've got full size wraps. We've got foot ankle specific. We've got knee specific, all specific types of red light therapy. But red light therapy is really powerful. That's the fixation. Okay, so you can see very similar to your case, Brenda, with the plates and screws. And I see those a lot. This is a young man using red light therapy for knee pain in the patella tendon. He is a 15-year-old, so he is growing, which means that he is lengthening his bones faster than he can lengthen the tissues and the muscles. So it creates a breakdown and inflammation in the knee where the patella tendon attaches the knee into the tibia here. But just red light therapy torch on there for 7 minutes every day, and we were able to manage his pain just using tape as opposed to going in and we're sidelining him where he can't take time. He has to take time off. That's how we managed his case, and used some kinesio tape in order to continue to re-educate his body. This is a really cool case. So this is an Achilles tendon rupture repair. This gentleman had no hope before he met me as to what was going to happen to him because he had a surgeon who wanted to just go in and butcher things apart. There are those doctors that exist, and then there are world-class legendary doctors who can save lives. He had come in to see me, and we got him to the right physician so that he could get the right kind of help. But he started developing trouble with the incision not remaining closed. So what do you use? Red light therapy, because it is a great wound healer. It's also great for bacteria. It's also great for creating more elasticity in the fibers that create the new tissue, the collagen fibers. Red light therapy is known for reducing inflammation, boosting collagen production, regenerating stem production naturally in the human body without any stem cell injections or interventions. It reduces redness, wrinkles. Anywhere you have wrinkles is tight, lots of tension. So it improves the elasticity. But the most important to remember, when you are going through regeneration of tissue, you want to make sure that you are drinking enough water because our connective tissue fascia is made up of elastin, collagen, water, and hyaluronan. So you have to make sure that you're rehydrating because 80% of that connective tissue, the scar tissue and the fascial matrix from the neck down is 80% water, and from the chin up is 90% water. So if you're not drinking enough water, you got to start there. But anyways, we were using red light therapy to save that scar so that he could continue on the journey of recovery. Red light therapy for shoulder pain, no shoulder surgery, just shoulder pain. But again, it reduces inflammation, and the red light therapy excites all the cells in the human body, the mitochondria, on a global basis, not just local, but whole body. And when you change the properties inside the cell, inside the mitochondria, now we're getting more energy output in the form of ATP. We're getting nitric oxide, which is an amazing substance that our body produces in order to open the vessels up so there's not as much pressure on the blood vessels, so blood pressure goes down in the way that it's supposed to. And the body can send that nutrient-rich blood flow, that oxygenated blood flow, to where it needs to be. Another form of recovery for that foot, ankle, or knee is our air compression boots at the same time of relaxing with red light therapy mask. So you can combine all these different methodologies and be perfectly safe, and it's wonderful how it works. So those are just some of the examples that I can show you with how I have used it. But I use this stuff every single day, and I've got clients that pay to come in and learn how to use it, how to apply it to themselves. So I'm going to go over some of the different products. I'm not going to go through the demo and the breakdown, how to put them together. We can go back to the YouTube video that we've already produced for that in the last year or 2 or 5, and you can learn what you need to know about the product and how to apply. But I do have all these clinical studies that I printed off because I'm an evidence-based person. So I wanted to make sure that the information that I'm providing you is cutting edge, clinically based, peer review studies, as well as medical based studies that we've used actual patients who are going through some of the same problems that you're going through. And it's pretty powerful how well it works. So the information I'm giving you is kind of pulled together. I do a lot of research in order to be able to deliver the facts to you. So it is quite profound what these products are able to do. When it comes to the vibration platforms, which you can barely see, let me see if I can give you a different, there we go. When it comes to using the vibration platforms, I'm going to kind of tell you what program to choose or how to decide which program to choose, how to use a modified position from a seated position, how your hips should be at a certain angle, and then we'll go from there. I'm going to end with that. I do have a burn. My daughter was wanting biscuits the other day. She's 14 years old, and she wanted biscuits, and silly me, I went to reach in because I was all excited that her biscuits were done, and I didn't realize I didn't have the full mitt, and so I burnt my forearm on the oven. Not fun. But you know what? Red light therapy heals burns really, really fast. So you just stick that on there. When it comes to the burns, if you don't want to make direct contact, if it is considered an open wound, if it's still seeping, then you're going to give yourself about an inch distance from if you're using a torch, or if you're using one of our freestanding units, that we've got multiple different types of red lights. You've got one that can be radiating from a static position, and you can position yourself into it, or you can use the torch. You can use the blankets here that I'm going to show you, but just if it's an open wound, just be very cautious in applying directly to it, because you're cross-contaminating. And as long as it's dry and not seeping, you can go direct contact. But red light therapy, 3 to 5 minutes, 1 to 3 times a day, every day for 3 weeks, and you will see major change. Major. Okay, so I'm going to start with our Aliva Red Pro Elite Belt. So those of you, this works really well for a knee. This will work for the foot, ankle. You can use this for spine, shoulder. You can use this for really about anything. But what I love about this product that we just released a few months ago is it has a rechargeable, self-attaching battery pack. So you don't have to worry about carrying cords and cables around. It is a detachable battery pack that you can charge through USB-C, or whatever you might charge your phone with, whether it's an iPhone or whether it's an Android, whatever phone you got, you can use the same cable to charge this portable rechargeable battery. It goes on, you're gonna push the power button, and then we've got a light show. Okay, so the lights are on. Now, if you are wanting to use this, let's say that you've got, let's say in your case, Brenda, since you're curious, if you've got a foot ankle challenge, see if I can position myself here. It's all about maneuvering, right? Okay, there we go. So you're gonna, you can position yourself however you need to, all right? But if your scar is here along the outside, you're gonna take the red light, and here's the thing, you can use whatever intensity that you want. Another thing that you can do with these, this is automatically default at 30 minutes right now, but when you push this button, or when you're changing, you've got not only infrared, but you've also got red light, and you can turn it into a flash show or like a pulse light. The button will teach you how to, it will, I'm sorry, you have to go back to the video and watch how to do all that. But these two buttons will actively change up whatever settings you want. You could go with the brightest level that you can get for 5 minutes, and then you can change to a pulse, which is going to be a light show, a little party for all those cells. Then you can go back to having all infrared and red light for a period of up to 30 minutes with this. So it's not going to likely cause you any kind of complications or burns or inflamed skin, as long as you are not using a photosensitive antibiotic, and as long as you are not using retinol creams or retinol-based products in the area that you're applying this. So if you are using a certain kind of cream that is photosensitive, make sure that you're looking at your labels on your pharmaceuticals or whatever kind of stuff you're putting on your body. And if you have something that is, they say to be careful out in the sun, that means it is photosensitive, so it can respond to red light and infrared light, okay? But we're going to, if you have your incision right here along the outside, you can wrap so that the lights are in contact with. You can get strategic in how you wrap, and because this thing is so big, you can wrap all the way up to the knee, okay? And it has an extra attachment strap, so you can use that to secure this however you want to. That's one way you can do it. Another way you can do it is to just, if you've got an Achilles challenge, then you can position your foot on top, and then you can position and wrap like such. You're still getting that ankle on the outside, and then you can use the extra strap. So here's the extra strap that comes with. And this is actually, I used to do a bunch of casting for doctors back in the day when I was learning all this good stuff with skincare, surgical post-op protocols. I've worked for 85 different surgeons in orthopedics and trauma, so I've seen it all. But anyhow, we can use our extra strap, and we can wrap it around like that, okay? And then it can come underneath. I know this is going to look really confusing to those who are not as flexible friendly. There we go. So now you've turned it into for your ankle, okay? And if you're in the same position, you can sit with that just like such. So you're actually getting the bottom of the foot at the same time. So see if I can swing around here. But that's what it'll look like, okay? So that's one way that you can use that for foot, ankle, Achilles, what have you. When you're using your red light therapy, let's make sure that we are putting it in direct contact with your skin, because we want to make sure that we are as close to in contact with our skin and our cells as possible. So if you have had a spine surgery, okay, we will pull up the shirt, and we're going to go underneath, and you can strap it on first. And then if you want to put your shirt on over the top, and then you can even tuck in the shorts on the bottom. So there's shorts on the bottom. So now the belt is in complete contact with me, and I can sit here for 30 minutes, get the treatment. You don't have to stop what you're doing. You can be sitting at your desk. If you've got low back pain from just sitting or not moving as much, or whatever you got going on, you can continue to put that on and do whatever it is you got to do without having to pause and make time for it. So great for multitasking. When it comes to your shoulder, absolutely, you can use it for your shoulder. So there's that. Excuse me, lots of talking, not enough fluids today. When it comes to your shoulder, if it's the front of your shoulder, you can run it through like that. So I just tucked it underneath my tank top. So we're going to go underneath. It's hard when you see it all in black. So there's going into contact. Actually, the straps, the sports bra and the tank top straps help to position everything in. So we can go that way, okay? And if you're trying to get the back side of the shoulder, it works exactly the same way. So now we're in contact. I don't even have to use the strap at this point. It's secure, and I can continue to sit without doing anything else. All I did was slide it under the strap of my bra strap and my tank top, and now we're off and running, or we're driving. You can do all kinds of stuff. So yes, you can use this around your shoulder. If you want to secure it, you can secure it like this. So you kind of secure it like a sling and swath. So it Velcros on. And again, if you need an extra extender strap so that you can maneuver it around a bigger circumference of chest, tummy, hips, whatever, a larger adult, then you have the strap included in order to maneuver it however you need to. Okay, so yeah, so we are working. There it is. Shoulder is completely covered, front, back, even part of my back. So that's how you would use it on your shoulder. Okay. Again, you want to have it in direct contact with your skin if you want to. If you have had breast surgery, whether it's a reduction, enhancements, mastectomy, you can, will not demonstrate that obviously because I would have to violate some privacy rules for social media. But what you can do is you can take off your undergarments and you would put this, most breast scars are underneath for most people. So you can cradle up underneath from the front and secure it on the back. You can go strictly off of feel, or better yet, another way, like trying to put on the big bra that you can't get everything attached. So you just wrap it on and then watch, you just turn it around. And then you just slide it up however you need to. And this would be in direct contact with. So you're getting the light therapy where the scars are located, but you're also getting the rib cage, which is quite vulnerable, but you're also getting part of your back because this panel is huge. So I'm getting red light therapy from here to here by just strapping it around my midsection. Those of you who are trying to lose fat around your tummy, it works the same way. If you've had an abdominal scar from a hysterectomy or a C-section, which I have both, then again, you just put it on, tuck it in your shorts on the front. Okay, so we're tucking it in, and there we go. Now my scar is actively being treated, and I get to do it from the convenience of home in the privacy, and we're strapped in and we are in direct contact with. Okay, but you do want to make sure that we are in direct contact with, because if it has to travel through your clothing, the cells are not going to get as much radiation from the light or as much exposure from the light. And it's the amount of exposure and the time of exposure that excites those cells in order to make the change within the cells. The cells is what makes the change in the signals and in the entire human body. So you cannot change the human body without changing the cells. You can, that's what the pills do, is it changes the integrity of the cells, it manipulates the cells, it changes the command in the brain, but we've got cells all over our body. So if we can excite and pamper and provide the environment for those cells to be happy, that's where the I'm going to say that's where we get the Yahtzee. That's where we get the bingo card, right? Bingo, Yahtzee, we got it, right? That's how we get it, is we got to get as many of those cells happy, because the happier they are, the more our body is working on a high level of feeling good, okay? So there's our Aliva Red Pro Elite belt with the self-enclosed rechargeable battery pack that does not require any cords or recharging on a regular basis. It'll run for quite a while. Those of you who have had a total knee, if you've had a total knee, or if you have had an ACL, meniscus repair, patellofemoral, anything on the knee or anything on the elbow. So if we've had an elbow problem, you can even put this on the shoulder, technically speaking. We have the BioRecover, okay? And with the BioRecover, it does have a cord, okay? You can go back and watch the red light therapy for the knee. This is specifically for the knee, but you can use it for the shoulder, you can use it for the elbow, you can use it for the knee, you can technically use it for the foot ankle because it contours too. These bulbs, these chips, these dual energy chips, so you're getting LED you're getting LED chips in red light as well as infrared. They're not the chips versus the bulbs, the diode bulbs. These are less intense than the others that I just showed you. So this one is going to be good and concentrated in one small area, but if you want a lot of power, go with the bulb specific versus LED chips, okay? This is very, very convenient if you're just wanting to walk around and you're wanting to stay focused on one area. The BioRecover is good for that. We have another knee brace that we just came out with, and I just did this live a couple weeks ago. It is a much smaller version of this. It has that rechargeable battery pack that I just demonstrated on the Aliva Red belt, and it's much smaller, and the chips, there are less chips. So if you're wanting something more economical, Velcro, user-friendly, cord-free, that other knee brace is really good, but you don't wear it to work out or for compression. It's strictly for phototherapy purposes. All right, getting my water here. Now, if you are looking for the full body experience without having to go to a local salon, okay, I'm going to show you, I'm going to bring you up closer to the table here so you can see the light show happening because it is really cool how this thing works. And I think last I heard, these might be sold out on our website for right now, but I think they're getting more of these in. But this is the Aliva Body mat. So it is not a blanket. Okay, we also have a red light therapy blanket, which is double-sided. This is just a red therapy mat. A mat you lay on one side at a time. Blanket covers front and back. So it's two of these is what makes up our wrap or our blanket, okay? I'll come to this side over here. Lots of cords today. Excuse me. Okay, light show. We got lights. So right now, we've got red light and near infrared light at 100% intensity, and we do not have our pulsed feature on at the moment. So I'm going to show you what that would look like, and you're going to laugh. It's truly like having a little party here. Yeah. So as you can see, the blinking is happening. It truly is like a super light show. And you can go all the way up to 90, I think, no, we've got even more than that. Hang on here. Hertz is going to be pulses per second. And this one has got a very high level of pulsation. So right now I've got it really, really high, so it doesn't even look like it's pulsing, but it's in pulse mode. If you're wanting more of the flickering light show and the pulse feature, then you're going to go less number because you're going to see, you're actually going to be able to see the lights flashing. Yep, hang on here. Yeah, it goes way up in pulse. So pretty cool feature. Let me start this over here. There we go. Okay, so you'll have to go back and watch the Aliva Body mat tutorial on how to operate this because it's got a lot of great features. But we are at 100%, no pulsation, and it does come, when you get your mat, it does come with a protective coating that I have already torn off of here, and it's going to look like a not so clear plastic. It's a film. You're going to peel that off before you use it the first time, okay? When it comes to wiping it off, just use a nice, if you are the only one using it, and your skin is clean, fresh, cosmetic and lotion free, that's something really important to remember. you want to make sure that you have nothing on your skin before you get on a red light therapy mat, because you're going to miss the best benefits if you happen to have creams and lotions, because it's a barrier between the exposure and those cells. So before you get on your mat, make sure and do a quick wipe down, or like take a wet cloth and make sure you get all the sweat or whatever gunk you might have on your body, so that you're getting the best application possible with the treatment time that you're putting into it. But all you're going to do, once I've got it on a very stable treatment table, you can put it on the floor. Be careful putting it on like a foam mattress because it does generate a little bit of heat. But if you can have it on a nice solid surface, you can buy, a portable table. If you're wanting to keep it up all the time, you can buy a portable table for less than $100, especially used. If not, you can lay it on your floor. I would put it on like a yoga mat or a fitness mat to make it a little softer underneath you, so you can enjoy it. But however you want to position yourself, but you just lay down on it, and whatever body part that you're trying to experience the cellular change is what you're going to make sure you have contact with. I've got my shorts on today, so what I can do, if I want more exposure, I can pull my shorts up a little bit higher, especially if I'm on a hip. And if I want to get hip on one side and inner thigh on another, you just, expose whatever you want to. But if I'm wanting to get more tummy and legs, then we just take the shirt and we tuck it under and we roll the shorts down. So we've got like a lot of stuff available and exposed. But the more that you can expose yourself to, the better. So if you can lay there in a swimsuit, if you can lay there in your underwear, if you can wear a sports bra or a crop top, or gentlemen, just take your shirt off and wear some athletic shorts. You can just lay here and meditate, listen to some great music, and just relax. It does get a little warm, but it doesn't get hot. Okay, that's where the red light therapy mat and the blanket and the pulsed electromagnetic field mats are different. When it comes to heat generation, the Aliva Body Fit is not going to provide, or it's not going to create a lot of heat, as when you're laying on it, you're not going to feel like you're not going to get hot just laying on it. So it's not like a heating pad. You're just trying to use those bulbs to transfer through. So it's really cool how it works. All right. So there's our Aliva Body Fit. Now we've got the Infrazen far infrared pulsed electromagnetic field mat. Okay, this comes in 2 different sizes. I've got the short one here on my treatment table because I've got the big one, which is 6 feet long, and it weighs a lot. It weighs probably 40 pounds ish. I've got it at my house because I use it at my house on a regular basis. But this one specifically has been created so that you can put it in an office chair, and you can use this while you're working in an office chair and experience not only the infrared, not only the heat, but the pulsed electromagnetic fields. What I want to make sure that you understand, if you are used to feeling the vibration of being on our platforms below, it is a very subtle feeling. Like, you're not going to feel a major change by laying on the mat when it's actively working. I'm going to bring you over here and you can see a little bit up close. Pretty cool having a little rolling cart here so you can see actually what's going on. So with this, you can see the white here, these little chips. Those are basically crystals, okay, that create the ionic change. So pulsed electromagnetic fields is all about changing the ionic energy in the cells, positive to negative, or what we would call biphasic, so it can go from one to the other. The more that you can neutralize or reduce oxidation levels in the cells, the better your cells are going to function, and the better you're going to feel. They don't become as mutated, if you will. This also heats. Okay, so it has an infrared coil built in here, in addition to the crystals, so that when it is turned on, if you choose to have the heat feature on, it will run at, I believe, 175 degrees, which feels really, really good. It's not like 175 degrees outside. It just feels very different kind of heat, like your sauna heat. But you can position yourself on here however you want to, whether you want to be in a seated position or you just want to lay on part of it. So the most of it is covering your torso from, chest to hips, or if you're working on the ankle, then you can sit on your space with your legs and your ankles on contact here. But when we're on here, okay, we've got our power button. And I had somebody ask me this not too long ago because they've changed the feature of the control panel just a little bit. But when we go to push the time button, okay, it goes up to 60 minutes. And there's times that I've laid on this for 60 minutes and I feel so good. Okay, let's do another 30. So if I got nothing else going on, I might lay on here for an hour or an hour and a half if I'm just reading or doing something. Hey, Debbie's just joined the party. Happen to see you, Debbie. But with the temperature here, we can, right now, this is at 74 degrees, so it's not super, super warm at all. And so I wanted to turn it on to 176. And then there's a little zigzag button. That's the hertz. Zigzag is the hertz at which the PMF fields are working. You've got two options, if I remember right. Let's see here. Hold up here. Actually, no, I'm wrong. You got as many options as you want. It goes up to 30 hertz. 30 hertz is as strong as this one gets. And a word of the wise, if you are on your PMF mat, anything from neck up, we want to keep at 8 hertz or less. We don't want to excite, like we don't want to go bonkers from here up, but from here down, 30 is good. And this taps out at 30, which is pretty darn good for a Life Pro product that's residential friendly, but commercial worthy, if that makes sense. Commercial worthy, but not commercial certified. There's the difference. Now, once you get all of those settings set, it's ready to go. There's no start button. You just let it kind of hang out there. I think I've got a product. There's a way that you can tell that this thing is actually working, because right now it doesn't feel like much other than heat. Okay. Somebody contacted me a few weeks ago and said, hey, Amber, I don't think my mat's working because I don't feel anything. Here's what's really cool. With PMF mats, you might not feel a whole lot right away. It's not what you're feeling when you're laying on the mat. It's what you're going to feel in days to come. Like you're going to feel your body transforming in days to come, the more consistent you are. So if you, I'm on here as if I were Brenda, who has a tib-fib fixation with plates and screws. We're trying to work scar tissue, trying to change what the energy is in the cells so that our body, from a cellular standpoint, it works on a better level of function. Pulsed electromagnetic fields, if I remember right from the research that I've read, because I've got a couple different textbooks on this, it's referred to as the fifth element of the human body. And, NASA has been who has discovered it. And it's very hard to experience PMF in a controlled setting where you get to choose the amount of energy you get without being in not only a medical facility or being at NASA or being in a human performance setting or going to space. But with the Life Pro products, you can experience PMF at home. And if you've heard of grounding mats, it is not exactly a grounding mat, but grounding mats are getting a lot of hype. Grounding sheets are getting a lot of hype. And why? Because it's changing cellular energy. So it is all about making sure that we are moderating, neutralizing the inflammatory cells in our body, because the difference in having cancer, diabetes, autoimmune disease, brain function, the difference in having good and optimal levels and not is how many of our cells have been mutated with bad energy. So a lot of oxidative stress overreacts the cells. They mutate. They can't keep up. And so the signaling in the brain through the nervous system to the body and the electrical highways with the meridians get way out of whack. And then our body starts attacking itself because it does not know what to do. PMF can help reverse that. It is not quote unquote a cure. I can't say that it's a cure because that's against the rules, but I can tell you that it makes a huge difference into how you feel. And it is a biohack. In order to biohacking is changing the environment of your body so that it can fix and regenerate itself. So we are not doing anything to your body that it doesn't really want to have done. So in other words, your body wants you to do this stuff. It needs you to do this stuff. Instead of putting all the crap in your mouth and going in for the procedures and the surgeries, yes, we choose to do that because we only have so much control over what happens to our bodies. And some of us have to have surgery in order to save ourselves. But it's what happens after the fact that makes the difference as to how you actually live your life after surgery. So having 2 surgeries in January, red light therapy, which I showed you, and pulse electromagnetic fields, as well as the whole body vibration, have been profound biohacks in order to help me bounce back faster and continuing to age younger as I get older. In fact, my birthday, my 47th birthday, is next week. It's less than 9 days away. Yay! I'm living younger right now because of Life Pro. Need more water though, so make sure you're getting your water. 'Tis the season of allergies. But anyhow, this mat is heating up. It's getting very, very warm. If you're wanting to experience PMF for especially like the back area, then you just lay it in the middle of your space and you just lay down so that when you're laying down, that your back is the primary focal point of your mat. And if you want to work back side, front side, you can work both sides if you like to. It's not going to hurt you to do that. But you can do too much. So too much can be a lot. Less is better. So as you're getting started, although you might not feel a lot of changes, just give yourself a dose and just see what happens and see how your body feels and run with it and just see what happens. So that's our PMF mat. I'm going to double check something really quick because I can prove to you that this thing is actually working through the pulsed electromagnetic fields. If you want to observe these products while they are in action, I'm going to go check and see if I can find this little thing because I know exactly where it would be if it's here. But I can hold it up to this and you'll see the magnets going nuts because it's actually reacting. Our body is very, ionic. So we have natural polarities within our body, plus minus. It's like magnetic energy. And I'm going to tell you right now, all injuries, all types of pain, all types of vitality of health run at specific frequencies. So we can actually heal our bodies by just changing the exposure of frequencies that we surround ourselves with. And that includes human beings. So what do I mean by that? If you are around people who are really negative people and you're absorbing that energy, it is changing your frequency because your mind has the power to change the frequency at which it operates, and that's generated through your thoughts and what you let in and what you send out. So make sure with Life Pro products and with those that you are surrounding yourself or those of us that are delivering awesome energy to you every day, every week, from the convenience of your homes, make sure that your inflow is greater than the outflow so that you don't drown in the overflow because you have so much more control over some of this than what you realize. You're just not taking control over your own health and you're letting other people tell you how to live your life because they make a lot of money. The organizations they work for make a lot of money. The pharmaceuticals they're pumping down your throat makes a lot of money. And they really don't care what you're thinking about because you don't know you have options. So I won't get on that soapbox for today because you probably don't want to hear that today. But being Good Friday and being that we have a lot of great gifts to share with one another, make sure that you realize that the thoughts that you think, process, the energy that you surround yourself with, changes the frequency of the cells within your body. And red light therapy and PMF change those frequencies as well. So natural exposure, natural experience equates optimal environment for you to heal and feel at your absolute best self, no matter how old you are. Hang tight. Have a look here as I'm talking to you. I'm going to double check and see if I can find really quick in less than 10 seconds whether I have this little gadget or not. And I just found it. That's why we are organized around here. Okay, so in this little container, you're going to see a little pellet of something. It's in there, I promise. If I hold this up to this, okay, I'm going to bring you over to see it. It is so fun. This is so cool. You're going to get an up close and personal visual. It is working. It is going nuts. Okay, can you see that it's actually moving? That proves to you, my friends, that the PMF mat is actually working. It is real, okay? And I can move it around, and you can't hear it because I got my microphone on, but I'm just moving around in some different spots, and you can see that little thing going nuts. That means the mat's working. It's legit. It's not just something you lay on and get warm on. It's actually healing. Your cells will experience that same kind of excitement when in contact here. And I just want to make sure that you know that you're not getting a dud. Oh, there's a shift there. Maybe. There we go. Oh, it's subtle here. So as you can see, it changes just a little bit. If I go back here to the center, it's having a little party. And if I go here at the seat where the seam is, it's a little different. So this can shift, and the frequency is going to shift throughout the mat. So it does work. It's cool stuff. And you get one of those with your product so you can test and make sure that's actually functioning. But it's a little jingle jingle. All right. We have covered a lot of stuff. The last thing we're going to cover is how to use your vibration boards, your vibration plates at home safely so that you can get better through vibration. Again, everything's blooming. So the air and the pollen and all the allergens, losing a little lump in my throat. Now, something that I want to share with you, and I printed this off because I do a lot of vagus nerve work here. I do a lot of vagal nerve stimulation. And if you're not familiar with the vagus nerve, we need to make sure that you understand what it's about. The vagus nerve is the most powerful nerve in the human body. It is one of our cranial nerves, which means that it exists up here in the top of your head, okay? And it actually branches off behind the ears. And the vagus nerve is responsible for whether you are in go, 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 trying to escape the lion that's trying to eat you, fight or flight, which is what happens when you have surgery. When you have surgery, your body is it's trying to keep you alive. Our parasympathetic nervous system and our sympathetic nervous system is part of our overall central nervous system, okay? And so the vagus nerve is our 10th cranial nerve, and I'm sure that you were probably seeing these words backwards if I had to guess. But the vagus nerve stems right here off of each ear, and it goes all the way down into the gut. So when you hear people talk about having a gut brain and having a real brain, that's why it matters, because the vagus nerve controls whether you are in recovery, restoration, and digestion, or whether you are in a state of constant fight or flight. Heart rate and respiration rate are elevated to keeping you alive. That's what happens when you go into surgery and they're putting you on a machine, is they're keeping that central nervous system stimulated when your brain wants to do other things. And so when we look at that's the vagus nerve pattern. And guess what? The vagus nerve controls talking and swallowing and gurgling. So I'll explain that here in a second. But if you look at the vagus nerve, it is that yellow nerve. It looks like a big firebolt, and it starts on each side behind the ear, and it travels all the way down. Vagus, the Latin word for vagus nerve, means wandering. It is a wandering nerve, and it influences every single system in the human body, and it is the one nerve that gets really pissed off when you have a surgery or when you have an injury. So it matters that you have to know, like, why the vagus nerve. And what you need to know about the vagus nerve is that whole body vibration makes it very happy. So when our vagus nerve is strained, those are the different systems that are influenced. And I don't know if you're seeing this all backwards or if this is if you're seeing this in reverse. You have to comment if it's hard for you to see it. But it starts up here. So your throat, swallowing, how you breathe, acid reflux, how respiration, our spleen, our liver, our stomach, our kidneys. Attached to the kidney is our adrenal gland, which produces cortisol, norepinephrine, and adrenaline. If you're in a constant state of go, 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 and your cortisol levels are really high, then you decrease what is called vagal nerve tone, which means that your body starts to suffer bad. I found LifePro because my vagus nerve was in really bad shape after a total hysterectomy, and my body would not function the way it was supposed to function. And I was only in my late 30s when all that happened. So, not good for a mother of a 3-year-old at the time. But in women, if you have had a hysterectomy, if you've had a C-section, if you've had any kind of abdominal surgery with your womanhood, the vagus nerve ends right at the very top area of the uterus. So when I had my surgery, they actually they did a new innovation type surgery and brought my uterus through my belly button to reduce pain pills on the other side of it. But man, that really pissed the vagus nerve off, and they didn't have that study done yet. So I became kind of a living study for that. Majority of women, they bring it through the bottom. So if the vagus nerve gets curled upward and it's just really unhappy, then there's a lot of things that you can try and do that will make you very nauseous, make you very sick, and then you can't function very well, which changes your serotonin levels, because 80% of the serotonin hormone, which is one of your happy brain hormones, is generated in the gut, in the stomach area. And so if your vagus nerve is not working properly, then you're not getting the serotonin into the brain, which is your happy hormone. It's what makes you feel good, what makes you happy. So you go into a depression, and then you think you're losing your mind, and you're not losing your mind. Your vagus nerve is just behind a lot of that. But our vagus nerve is a very powerful nerve. Well, it turns out, I just did some research on this within this past week. Lots of studies here, lots of 6 studies. It turns out that the vagus nerve loves and thrives on infrared, red light therapy, PMF, and vibration. So that's why we're covering this today. Because the vagus nerve, if your vagus nerve is not working properly, okay, this gets really confusing, so I'm going to keep this very straightforward, not too medical. The vagus nerve effects for the brain is it helps modulate anxiety, depression, and kind of calms things down when you're in a constant state of stress. So if your vagus nerve is not working the way it should be working, then you develop more anxiety, you develop more panic attacks, more PTSD. There's just a lot of mental health things that happen because of simply hormones changing because of how that nerve fires the signal, okay? In our mouth, the vagus nerve allows for the gag reflex. So if you've ever heard of somebody just being normal one day and they just happen to be out and about and then they just faint out of nowhere, that's the vagus nerve working. The vagus nerve can cause us to faint, can cause us to throw up, it can cause us to gag in order to protect us from doing something that our body feels as a threat. And our body's mammalian instinct, our gut instinct, is always going to trigger a response to the vagus nerve, because what we feel with our heart and through our emotions is not always going to keep us alive, but our mammalian instinct in our gut will. And the vagus nerve affects that. So vagus nerve can change inflammation in the mouth, on the tongue, in the gums, how you taste food. So any of you that have lost taste or smell because of things that have happened through the pandemic, the vagus nerve is what suffers. So I have started offering vagal nerve stimulation external application at my facility, and we have reverse taste and smell fast, because all you got to do is pamper the vagus nerve, which you can do for free at home with LifePro, and I'll teach you some of those methodologies here in a minute. When it comes to vagus nerve with the gut, it increases gastric juices in the secretion. It provides gut mobility and balances stomach acid. So if you are having trouble with acid reflux, if you are having trouble with eating and you have a lot of gas issues, vagal nerve response happening specifically to the gut area. If you've tried changing up your diet, you've tried different medications and you're not getting any better, start tapping into making changes in your vagus nerve. When it comes to the lungs, diaphragmatic breathing sends a signal to the vagus nerve to increase bronchial dilation. So people who are really stressed, anxiety, panic attack, mentally going bananas, the best thing that you can do is learn how to breathe through the diaphragm, which is this ginormous muscle that separates your rib cage from your hips. And it also fuses in with the most powerful muscle of the human body, referred to as the psoas muscle. Most people don't think that the diaphragm is that big of a deal, but it's probably one of the single most important muscles in the entire body that we have. And so to give you some perspective, that big umbrella shaped red thing, that's your diaphragm. And so if you can learn how to breathe through that flap that's controlling everything happening below it, which, oh, by the way, which is where all of the organs actually sit for this. That's why diaphragmatic breathing in for 4 counts, holding for 4 counts, blow out for 4 counts, hold for 4 counts. Worst case scenario, breathe in for 4, blow out for 6. If you're reactive breathing, right, we're breathing in way more oxygen and not releasing enough CO2. So we have an imbalance in the gas of the chambers, which is the number 3 cause of shoulder pain. Believe it or not, breathing improperly is the number 3 cause of shoulder pain and a high level of back pain. So you can actually change back pain, and you can change shoulder pain, and you can change neck tension simply by learning how to breathe. Pretty fascinating. So that's really important to know that the vagus nerve controls that. So diaphragmatic breathing is really important. Your blood vessels, the vagus nerve decreases vascular tone, resulting in a lower blood pressure. So those of you who are taking medication for blood pressure, for high blood pressure, start hacking into vagal nerve tone and increasing vagal nerve tone using LifePro or using natural methodologies at home, which I can share with you. With your liver, it regulates the endocrine response to maintain glucose, insulin response, homeostasis, and keeping your liver functioning. You don't have a liver, you're kind of screwed. You can live without your spleen, and we can change how the stomach regulates. But if you don't have enzymes taking place in the liver, you're in trouble. So with the heart, it modifies and regulates your heart rate, heart rhythm, and the electrical signaling that goes along with that. And finally, this is the really important one, is inflammation. Like most Americans have got systemic inflammation. The vagus nerve suppresses unregulated inflammatory responses. And so when we're talking about how inflamed our body is and how it changes, how it's able to maintain its environment, that is going to be heart rate, respiration, electrical firing through the nervous system, how everything turns over, how we eliminate waste, where those wastes are stored if we can't eliminate them, and how our body keeps itself cool and how it keeps itself warm. That is all controlled by the vagus nerve. And LifePro can help enhance that vagus nerve functioning so that you can continue on and thriving at the best way possible as you age forward, feeling younger. When it comes to, I'm going to show you a picture of the vagus nerve ideals. If you're wanting to look at vagal nerve tone, you can take a photo of that, or I can post a picture of this to the VIP Facebook group. But 10 signs, if your vagus nerve is not functioning the way it should and is affecting all these different systems, and you're not feeling good, and doctors are trying to help you, and you're not responding, and you're miserable, and you're frustrated, I want you to listen to these symptoms. If you have any of these things going on, and you're feeling mentally or seeing physically, then you've got what is called low vagal nerve tone, which means you need to boost. We need high vagal nerve tone in order to optimize performance as a human in our lives. If you have digestion issues, you've got irritable bowel syndrome or severe constipation. We've got acid reflux, or we're super bloated, like we're gassy all the time. We've got anxiety. We feel like we are just constantly putting out fires, like we're just really uptight all the time. Panic attack, feeling like we're having a heart attack, but it's really a panic attack. We're feeling depression. We're feeling disconnected. We really don't want to be around anybody. We're not motivated. Like we've got chronic fatigue. We are not motivated to do anything. Just no matter what kind of lightning you get underneath your booty, no matter what fires in your tush, no matter who's pushing you along or pulling you by the leash, you cannot get motivated to do any of the most basic things. Been there, by the way, been there. Chronic pain. You have systemic pain. You've got things that are happening throughout your entire body. And when I say chronic pain, you got shoulder issues, you got neck issues, you got your foot hurts from time to time. You feel like your knees are getting stiff as you try and move around a little bit. Chronic pain. So that means it's been going on for more than just a few weeks, and you might have been dealing with it for years. You've lost your appetite, or you get full really quick. So we're not super hungry. Like we're not like I should say we're starving. If you're starving and you just can't get enough, that's a little different because your body's in a fight or flight, go, go, go. It's like trying to refuel itself. But the problem is if you are in fight or flight, you cannot digest. So body gets sick when you try and eat a lot when you're in a constant state of go to go go. So if you lose your appetite or if you are feeling really full really quick, that is a sign that you've got a vagus nerve problem. Excuse me. If you are hoarse or you are wheezing or you losing your voice, this happened to me over the winter. So if you're wondering where Amber's been for the last 3 months, I took my daughter to New York City for Christmas. And so we were in New York City leading up to the week of Christmas. We got on the plane, came back home on Christmas Eve, and went to bed. The next day I could not talk, had no voice, was running a fever, and I was in bed for 5 days, feeling like I got hit by a freight train. My vagus nerve was really pissed off. My body was trying to fight whatever it is that I had. I tested negative for strep, negative for COVID, negative for the flu. They could not find out what was wrong with me. So I lost my voice for almost 8 weeks, like really hoarse, couldn't get a high pitch, couldn't get a low pitch, had inflammation in my mouth. So my gums were bleeding when I brushed my teeth. If your gums are bleeding when you brush your teeth, you are inflamed. That is a sign that you've got high levels of inflammation in your body because your mouth is a replica of your gut. Okay, the mouth lining and the mucous membranes is a replica of what's actually happening in the gut. So if you have blood when you are brushing your teeth, you got a vagus nerve issue. Loss of gag reflex or difficulty swallowing. So if you have trouble swallowing, or you lay down at night and you feel yourself suddenly like choking, that is another sign of vagal nerve tone. Heart rate and blood pressure changes, one extreme to the other. You can go super high, you can go super low and crash. Autoimmune issues. I'm right there, been there, done that. In fact, was going through the holidays after my first year in divorce, was divorced last summer, and went through Christmas, Thanksgiving. I've got a 14-year-old daughter and was going through all this for the first time in my life, emotionally devastating. And so naturally, when you can't control the thoughts, it changes the system and how it functions. And so my autoimmune kicked into high gear. And so I had to make sure that I was using some of these products to making sure that I was staying ahead of the curve. But some of it caught up with me, and I ended up with Bell's palsy. Bell's palsy is a paralysis of half of your face, like borderline mini stroke. That happened to me in November. So I had to go get some acupuncture done, use the red light therapy, pulsed electromagnetic field mat, used my vibration platform just to relax, did a lot of deep breathing, ran the vagal nerve stimulator on my body, and flipped that switch of Bell's palsy in less than 2 weeks and got on a plane to go to New York City. Get home from New York City, train hit me. I was down and out for at least a month, had to reschedule my surgery, which was scheduled for January 2nd, scheduled it for January 17th. So put my body through 2 surgeries in one episode and lost my voice for 8 weeks. So that's where I've been. And here we are back, and we are feeling younger and better and happier, and life is good. Insomnia and other sleep issues, and especially for ladies. If you're having trouble sleeping through the night, trying to fall asleep, it is a hormonal shift. The vagus nerve changes how all of that fluctuates, and you have more control than you realize in controlling hormone fluctuation as you're going through perimenopause or menopause if you know how to tap into the vagal nerve response. So that's all vagal nerve tone type stuff. Now, what are the strategies? Again, I will post a picture of this in the VIP group on Facebook. So if you're not already part of our VIP group, make sure that you join our group and our team. But for those of you who aren't, if you want to take a picture of the screen, if you can see that, I know it's like a really hard picture to be able to see, but I created this document for a speaking panel that I did. Whoops, that's not right. There we go. I was part of a speaking panel in Whitefish, Montana, in which I was working with some of the instructors from the Navy SEALs and the state of recovery. And being a recovery expert, I got to teach this to about 75 people. So I created this document. So if you take a snapshot of that, and I will include a snapshot of this so that you can print it off in a PDF file. Some things that I do every day that make me happy, that requires nobody, no money, no location. I love to sing and I love to dance. Why? Because singing makes our vagus nerve happy. So it requires us to use these facial muscles, and singing is known, especially if you're listening to music that you love, or even just pretending to be a superstar, but you're really not, right? I sing in the shower every day, and I sing in my car when I'm alone, even when I'm not alone. But if you sing, no matter what you're singing, make stuff up. If you're singing, if you are chanting, that is a way that stimulates the vagus nerve. And again, it branches off behind the ears in the cranium, and it affects everything down the line as a wandering nerve. Chanting happens to make it happy and stimulates it. So if you're struggling with some of the symptoms I shared with you, resulting from surgery or not, you can just experience that from stress. But you can go through all of that stuff. Your vagus nerve can be completely zapped just from going under anesthesia without anything else happening. That actually happened to me. It's happened to me like 3 times. Chanting, singing helps to enhance and stimulate that. Meditation, however you consider meditation. I consider meditation clearing my headspace. And actually wrote a book about this, was just launched 2 weeks ago. If you go to Amazon, it's called Coaching Greatness by Todd Durkin. I'm a co-author of that book. If you go to a deep space in your mind, the root cause of all pain and suffering, according to the data and the clinical statistics, is our own thinking. Our own thinking. We process 60,000 to 70,000 thoughts per day is what we actually process, which is exhausting when you think about it. And 40,000 of those, for most people, are negative. And you become what you think. So meditation is all about calming the storm down in the mind, opening your mind up to just letting thoughts pop into your mind without any effort whatsoever. And I did some research on this before I wrote this book. All of our best thoughts, all of our positive thoughts happen in a natural state of being and no thinking whatsoever. So meditation, it allows you, it is not religion based. I want to make sure I'm clear with that. It is not a religious specific practice. It can be incorporated with religion, but if you say that you're meditating, it doesn't mean that you're praying, and it doesn't mean that you're following a certain religion in order to do that. So don't get caught up in that. But meditation is just simply being in tune with yourself. It's being mindful, being in control over your space, or just shutting it off. I have a former client who contacted me and told me about the nothing box, which evidently a lot of men think or don't think in what's called a nothing box. Women, it doesn't exist, because we as women, biologically speaking, hormonally speaking, our brain generates way more thinking processes than men, which is not a bad thing. It doesn't mean that we're smarter by any means, although I like to pretend like I'm smarter in some of those ways. But what it does, though, is that it changes the effort behind our mind. So our thinking is a verb, it is an action. Thoughts is a noun. Thoughts don't happen because of us thinking. The thoughts happen naturally in a positive state of no thinking at all. It is how we judge ourselves, it's how we judge each other, is what we are worried about with people thinking about us, that changes those natural thoughts in the natural state of being to toxic. And it's the toxic that causes this. So get your mind right and stop the toxic thinking, stinking thinking, I like to call it. And gratitude, meditation. I like to think of gratitude. Like, what are you grateful for? I'm grateful to be able to share Good Friday with all of you today. I was supposed to have a full schedule today with 3 clients. They all 3 canceled in the last 24 hours. And it is a beautiful, perfect day outside. And I'm not worried about replacing those appointments, because I get to spend more time sharing with you, and I get to go outside and play. And I was planning on being indoors working on people all day. And so gratitude is, I get to share Good Friday with all of you. I get to make a world's difference in just one of you. If one of you benefits from this conversation, that is awesome gratitude, because purpose is not who you are or what you do. It's what happens to others when you do what you do. So I love being able to make a difference in all of you in some capacity. So singing, meditation, chanting, massage, guess what? The vibration platforms provide the free massage. It's a magic machine. You just got to get on it and push go. But if you have some of our massage devices, massaging, you don't have to pay somebody like me to do it. We offer so many different types of massage gadgets at Life Pro that you can use for free at home and feel great. But it also enhances that vagus nerve. Pilates is another. Laughter. What has made you laugh today? Okay. I want you to think about what has made you laugh today, because if you're not laughing every single day, I think I've laughed several times in this episode today, but if you don't laugh every single day, the vagus nerve starts to crash. And guess what? When you laugh, you get a dose of happy hormones. You get dopamine, which is addiction. You get oxytocin, which is our love. Serotonin is our gut regulated happy. And then endorphins are natural painkillers. So it's an awesome thing. Laugh out loud, even if you're just laughing at yourself. So let's do an experiment here. I'm going to come up with all these different ways of laughing, and I'm going to make an idiot of myself, and I don't care. But I want you to laugh from the convenience of your home, because I don't get to see you all. But I want you to hear yourself laughing, and then let's see how we feel after the fact. So if you've seen Mary Poppins, the floating tea party, they're laughing so hard that they all start floating, and then they have to burp in order to drop back down. I think that's how that went. I haven't seen Mary Poppins in a long time, but he comes up with the snake laugh and a ha 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 and a ho 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 and a he and a tss, right? So let's just laugh. Snoopy is one of my favorite videos to watch. If you've never heard Snoopy laugh, right? With Stuck and Snoopy together. So I want you to laugh. Let's laugh out loud and have fun with this. Like, I don't know how I laugh all different kind of ways. So make sure you're laughing, because I can't hear you. You can hear yourself. You're probably making fun of me at home, which is totally cool, but you can even snort, right? Just did it, right? That's not my normal laugh. Okay, so laughter is really good for the vagus nerve. Breath work, okay? So to calm down the central nervous system, to elevate the vagal nerve response, we're going to breathe in for a count of 4. And we're going to blow out for a count of 6. We're going to have a blow contest, okay? When we breathe in, we are breathing in through the nose, so we're filling the lips. And then we're blowing through a chubby straw. So 4 counts, breathing in. If you can hold it for 4 counts, thumbs up. Blowing out for 4 to 6. And then if you can hold off another 4 counts before you breathe back in, game on. If not, you still got a Yahtzee. You're still really close to bingo, okay? So let's breathe in. That's how you do it. Blow contest. Breathing in through the nose, blowing out through. Because if you go, well, you didn't really control that. But they also, that was too good. They also make a type of breathing, I'm sorry, not they. There's also a type of breathing called ha breathing, where you can just let it all out and just relax. So if you're in an upper heightened state of stress, right? It's another way to regulate that diaphragmatic response. So, ha breathing. Because that allows you to release, but not, right? So make sure that we're not, because that actually will cause hyperventilation, causes the heart rate, respiration rate to go through the roof. Vagus nerve goes bananas. Fight or flight response goes up. Stress levels go up. Blood pressure goes up. You not happy. So that's how you can control that. Intermittent fasting. Intermittent fasting helps with vagal nerve response. So I am one who does intermittent fasting. If you're not familiar with that, that's not my expertise. I'm not going to teach you all that today, but might learn some information about that. Talk to an expert. Gargling. So putting water in and gargling. Let's do this. This is one of those learning opportunities today with LifePro. You take your water, just like that. Don't choke yourself, though. I was laughing at the same time. So you get laughter and you get gargling. Might take a little less water. So gargling helps with vagus nerve. Socializing, kind of what we're doing right here. We're connecting. Love it. Going outside, forest bathing, walking in nature outside the concrete jungle if you can. If you can't, get outside your home and walk around outdoors. Breathe the fresh air. Listen to the sounds. Enhance and heighten the level of your sense. Cold exposure. So if you've had access to our cold water plunge tubs, that we make several of them, cold water plunging, it really zaps the vagus nerve. It shocks the system, regenerates. Life is good. You just got to get yourself through it. Watching a sunrise or a sunset. Not sure how many of you know this, but if you are visualizing the sun rising and then you come back at the end of the day and you watch it go down, our pupils are a gateway to our brain and hormone regulation. So our hormones actually regulate based off circadian rhythm through watching sunrise and sunset. So when we go through these long winters and there's not as much sunlight out and we have daylight savings change of time, then we don't get the same exposure through the natural sunlight with our pupils, but the pupils are the gateway to how our brain regulates homeostasis as well as hormone generation and release secretion. So there's that. Sunbathing. Yes, the sun is actually good for you in doses. So I do go to the tanning bed because I don't get to lay out in the sunshine and it's cold here. But being in sunlight radiation in controlled doses, it makes a big difference on how your vagus nerve works. Acupuncture, I offer that here at my facility. If you have somebody in your area, run with it. Grounding mats, grounding sheets, PMF, red light therapy, grounding. Working through the feet. So it's neurosensory through the feet. 80% of the nerve cells that give your brain feedback where you're at in space are in the skin on the bottom of your feet, and how you excite those is how you're grounded. So yoga, we've got our different modalities that I've already shared with you. Those are all wonderful ways on how you can stimulate your vagus nerve. And last but not least, if you have a chiropractor that you love, chiropractors are really good at helping to enhance vagal nerve regulation and control. Now, for those of you that are still hanging on, the best for last, and it's the vibration platforms. So vibration helps to make vagus nerve very happy in doing a lot of different ways. So I'm going to show you the process in which you should consider in using your vibration board or your vibration plate, as we call them. And I'm going to position you guys a little lower so that you can see everything going down. There we go. Yeah. So you're going to get to see kind of how Amber does things with the vibration. Sorry to like move everything around on you. Oh, that doesn't want to stay put. So let's see if we can try and keep this where it's at. There we go. Okay. Now, what is really important is that when you get on your vibration board, we want to make sure if you are in a seated position that your knees are sitting at a lower level than your hips. So in other words, you don't want your hips lower than the level of your knees or you're going to have some trouble, okay? This is the Waver Mini. If you don't have to have anything fancy, you just need to get on vibration in general. So the Waver Mini, multiple different program levels. If you are just coming off of surgery, whether it's lower body surgery or whether it's any kind of abdominal work, shoulder surgery, start in a seated position. If you are in a cast in the lower extremity, not a walking boot, but if you are in a cast, wait until the cast or the splint comes off and they do the suture removal before you get on one of these. Most all doctors are going to do suture staple removal 14 days post-op. So let's wait for 14 days at least before you try and use the vibration boards with your lower extremity if you have had a lower extremity surgery, okay? Otherwise, if it is up top or up in here, you're good to go in a seated position because you're allowing vibration to be a little more limited. So I'm going to continue to adjust this so you can actually see my head here. All right. Now, you can choose whatever program you like, and you can choose that, you just push the program button. I like to choose a preset program, but I'm just going to stay in this seated position and just let my body just kind of do its thing. It is just jiggle, jiggle, jiggle. But just getting blood flow moving, just stimulating motor activation in our limbs. Like all of this is going to help our body at getting better, and it's going to help the vagus nerve, the vagal nerve response. And I feel really weird being cut off with my head here. So I'm going to take you guys back up here so you can see the long view of me. Sorry, I keep moving things around. Oh, there we go. Now you can see. So we just we make sure that we're sitting higher than the level of our knees. So in other words, we don't want to be down here. We want to make sure that we're sitting up a little bit higher if you're in a seated position. And again, you can start vibration. If you've had a surgery up here, I'm not feeling much of this energy traveling through to my hips. Yes, it's engaging my pelvic floor just a little bit, but nothing here abdominal. So you don't have to worry about the vibration platform will not cause a hernia. I'm going to tell you that right now. You can cause a hernia because you are reactively breathing improperly or because you're holding your breath. You can cause a hernia, but the vibration does not cause the hernia. Just want to make sure that we're, you don't have to worry about any kind of, if anything, it's going to help eliminate some of the toxins, especially from anesthesia, from the surgery itself. So you're going to start in a seated position. If you are feeling good and you get up the next day and you feel great and you want to take it a little bit closer to where you're almost hovering, so you can go into a leaning position to a sitting position. So if we've not had a total knee replacement, or if you have had a total knee replacement, if you're 3 weeks post-op on a total knee replacement and you're supposed to be working on range of motion and you're on a bike, then let's go from here to partially standing and then sitting back down. So we're just moving up. And if you want to stand tall, you can stand tall. But when we're just in a seated position like this, yes, we're getting blood flow. Our body has to have blood flow. It has to have circulation. It has to have a lymphatic activation response, because when we have had anesthesia or if we've been through a trauma in which we have a scar or we've got a major injury, our lymphatic system is trying to eliminate all the bad stuff in our system as it's trying to continue to heal us. But the less we move, the more stagnant and the more toxic we become, which delays healing. So being on the vibration boards, the vibration plates, allow us to recover faster just by getting muscles refiring without cognitive effort and getting stuff flowing. It takes tension off the connective tissue, so it allows it to completely reshape itself. So again, you can just go from a standing, and if you want to stand and relax, just make sure, do not lock your knees out. Make sure and keep those knees nice and soft at all times, and just back and forth. The closer your feet are to the center, the less energy. So if you feel out here is too much and you don't like the way that that feels on your legs, if you've had surgery up top, then bring your feet closer together and you feel less energy transfer. And then you can try and do a little bit of a hover, and then you can try and stand, and then you can hover again and you can have a seat. Super, super easy. Now, if you have had pelvic surgery and your doctor wants you doing no driving, not supposed to be carrying anything heavier than 5 pounds, but you're supposed to be walking, okay? If you're supposed to be walking, guess what you do when you walk? You're impacting vibration in contact with the ground. So you can do this in a seated position, not standing, but in a seated position, and then just you being in contact with the energy of the vibration travels up into the torso, but it's not shaking things up a bit here. If you are, 3-4 weeks post-op on a hysterectomy or any kind of abdominal surgery, now you can stand and take it to another level if you'd like to. If you are scared to death of any of this and you still want to use your vibration board and you have not had a surgery from your knees down, but you got the restless leg syndrome going on, or you're getting cramps, or you just are not feeling good and you just want to zap some energy in you and feel good for a change, then we take it to the floor, okay? Then we take it to the floor. So you can have a seat on the ground and you can put your legs on top of the machine Or you can put the machine technically on your bed or on your ottoman next to your couch. I don't recommend putting the heavy one, the 30, 40-pound one. This is a very light one, like 15 pounds. But just putting your legs up here will make a huge difference on circulation, lymphatic, dynamic improvements. There's a lot of feel good. And again, because those nerve bundles are on the bottom of your feet, we're exciting those, even though they're not in direct contact with, but you can just put your legs on here and just relax. Now, if you have had a lower leg surgery, a foot ankle surgery, and you still need to feel some happy time, then just have a seat directly on the platform, and then you've got your leg out in front of you in your boot or in your cast, and you're still receiving the activation from here up, but you're not getting any vibration in the lower limbs. So your surgery or whatever they've done down here is not, even if my legs are shaky just a little bit, it's not going to cause harm. It's only going to help things. So you can stay in your boot in a position like such, or heck, put the leg up on something. You can even do that. Put your leg up on something and still sit here, and at least your torso, where the vagus nerve is, can still get some of that energy. So that's how you can use vibration. It doesn't matter which machine. This is the Rumble X Plus. I use the Rumble X Plus every single day on every single client that I see. Even the spinal cases, I've had multiple spinal surgery candidates coming in, and we use these in order to save them from surgeries a lot of times. But just sitting on here, I like the P2 program, just sitting and just responding, just receiving the energy feels great. And then we can go from there to a leaning position. So if you have back pain, you can put your hands on your knees and not have to stand all the way up, but you can feel the vibration transferring through the hands from your knees, and you can feel that a little bit into your back, but not to a level that it's going to cause more pain. And again, when in doubt, just bring your feet closer together as opposed to further apart. The wider you go, the more they jiggle. So, but you gotta shake up the junk in the trunk in order to get rid of it. It's not going to go away by itself. So the more that you can jiggle, so you can see my body is jiggling happy. Most people are really ashamed of what this looks like. I tell people, embrace it, man. Like, we are breaking free fat cells. We are using up the fuel in the stores. We are generating ATP. We are generating nitric oxide. Vessels are happy and open. Heart rate is better, happier. Life is good. Like, it is the happy machine just by being on it. So that's, I think I covered a lot there. I don't think many of you plan on being here for an hour and 45 minutes, but it's been a great episode to share with all of you today. And I can't think of a better way to share Good Friday than to be good with some of the greatest people on the planet. So thanks for allowing me the time and energy to share with all of you today. Debbie and Roseanne and I and Joel, we love what we get to do for all of you. So if there's something that you're needing from us that we can help you with at home that we haven't already offered, then don't hesitate to reach out to us. We all have our own individual pages. We all have our own special niches that we work on. I'm in sports medicine, as well as human performance and mental coaching. I'm certified in over 20 different methodologies. I do a lot of massage, acupuncture, cupping. I have invented my own cupping brand. Debbie, her niche is the vibration plates and red light therapy and PMF. She is one of the greatest experts in the entire world on vibration and has been doing it over 30 years. So if you have questions on what you need to set your machine on in order to get this outcome, type in to YouTube Life Pro Debbie vibration. Just those 3 words, and it will give you a plethora of amazing content for free, in which any other place you go, you're going to pay a fortune to have that information one-on-one. Same thing with Amber. If you're wanting to learn about how you can improve pain in a foot ankle, plantar fasciitis, type in Life Pro Amber plantar fasciitis or Life Pro Amber hip, and it will pull up every video that we have done for Life Pro for hip pain or whatever. That is the fastest way to get the information. Some of those videos are 4 or 5 years old. They've been with Life Pro since 2019. And Debbie's been with Life Pro just as long. But Roseanne is more specific to fitness, wellness, Pilates, yoga. So if you are interested in the workouts, and she is approaching her senior years with finesse, looking beautiful and younger than ever. If you're wanting to age younger as you get older into that senior citizen masters athlete phase, Roseanne is your girl. But Roseanne has got a lot of great techniques, workouts, and is a very good educational instructor for all types of wellness and fitness. Lots of different workouts that are available there. So we are here to serve you. If there's something that we haven't done, we need to know, because I'm pretty sure we've covered it all. You just might have to dig for those videos a little bit. But nonetheless, we are always coming out with new products. My machines are vibrating across the floor. That's how good they are. But nonetheless, we are coming out with new stuff all the time. And we are so proud and so humbled to be able to share positive energy for all of you so that you can use it and take action and live your best life, or a better life than where you're at in the moment that you're watching. So whatever we can do to bring out the best in you, that's what we're here for. So happy Good Friday. May God bless all of you, and thanks for watching, and have a wonderful weekend with your families.